Do you need a breast lift, breast implants, fat injections, or all of the above? Let's break it down. So each of these things solves a different problem. If your nipples are too low, you definitely need a breast lift of some type. How low your nipples are, in other words, how low they are and how far they need to travel up to where they're supposed to be, will determine what type of breast lift you need, which could be the donut lift, the lollipop lift, or the anchor lift. How much loose skin you have will also play into what type of breast lift you need. What size implants you get doesn't necessarily affect the type of lift you need with respect to nipple position, but it can affect the type of lift you need based on changing the amount of loose skin. So if you have very loose breast skin with low nipples, you will need to have less of this extra skin removed or tightened up if you get relatively large implants. But it doesn't change the fact that your nipples need to be moved up. So that may commit you to needing a breast lift no matter what, depending on the level of your nipples on your body and how far they need to go north to sit at the appropriate location on the implants. Whether or not you need implants depends on your goals regarding breast size. If all you're having is a breast lift, you're probably going to end up about 1 cup size smaller than you were before, if that. But plan on losing about a cup size as part of the breast lift. If you're okay with that, you do not need an implant. If you want to be larger than your current size, or you don't want to go down in size, then you need to have an implant placed or fat injected or both. One thing that implants can do that nothing else can do is add that upper pole fullness or convexity. So if you really want that augmented upper pole fullness, that round youthful look, you probably need to have at least a small implant placed to give you that upper pole fullness or that convexity. If you want a little bit of volume added, fat may be enough, and then you don't need an implant. So in summary, breast implants, breast lift, fat injections are all of the above. Implants and fat injections add volume, especially upper pole fullness. The breast lift tightens up the skin and positions the nipple at the appropriate level on your chest. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.